My name is Elaine Villasper, as are she, hers, and I work at the Filipino Community Center. I'm the associate director there. So we have general services that we provide: immigration support, workers' rights, and employment support. So those are core services that we provide already. And under COVID, we still provide those same services, except there's kind of just new needs that we've had to raise our specialty level on and kind of just learn also. So a lot of people call us for accessing EDD and unemployment benefits, and so just figuring out how to file an application. Do they qualify or not? I mean, majority of the people that we serve are workers, are immigrant, either newly arrived or have been here. Many are also limited English proficient. And they don't have technology. I mean, usually have like Wi-Fi, or they might not have a computer or an iPad or anything like that. And so much of our work with the employment support or the workers' rights staff is doing phone consultations and then filling out the forms for them online. So our folks, pull it up on their computer, and then we have the consultations on the phone, and we basically are asking them the question and filling it out for them, just because we have the computer. And then we, a lot of like figuring out workers' rights, if they get laid off, or if they have less hours, special instances where there's workers who actually contracted COVID because of their workplace. So helping them talk to clients or talk to lawyers, kind of just figuring out what their best next steps would be. And then the new thing that we started to do, food deliveries to homes. Many of our clients and our community members, they're caregivers, kind of high risk already because of their age, but because they're also caregivers, they're caring for their employer. They're caring for people who are elderly, much older than them, or are sick or are immunocompromised, and so their employers or the people that they care for can't leave the homes. So many of them actually choose to shelter in place at their employer's house. Part of their challenges in accessing food, or going to buy groceries, because they're just at the house. And so we started to do food deliveries every week, and at first they were prepared meals, and now we're starting to we've been able to partner with some of the food bank pop-up. Starting this week, we'll be able to start delivering groceries as well. More concentrated needs, and so we've had to we're technically deemed as essential workers, so we could, if we wanted to, maintain operations at the office. So we've had to move all of our operations remotely, and so lots of learning. That's a huge learning curve for us. That's not usually how we do our work. We do a lot of our work in person, and so just figuring out what technology we needed, and just what tools and kind of services we had to get that we didn't normally use. A lot of the needs are also very concentrated, and because they're so immediate, it's really busy in a sense where, like, you have to, when they call and they make an appointment, we really have to see through what they need in like a day or two, when before we might be able to space out their needs, because it might be like immigration or with a lawyer consultation, and those things could take 1 or 2 weeks, and we have a little bit more time for them. Now now the phone rings off the hook, and our case managers and our volunteers are really busy just kind of helping people through.